Welcome to Angel Health Academy. Subject of the day is definition of nursing education. Definition of nursing education. Definition of nursing education is a professional education which is consciously and systematically planned and implemented through instruction and discipline and aims the harmonious development of the physical, intellectual, social, emotional, spiritual and aesthetic powers or abilities of the students in order to render the professional nursing care to people of all ages in all phases of health and illness in a variety of settings in the best or highest possible manner. So this is the definition of nursing education. As you see this definition, it is very lengthy and very broad and very vast. So it is very difficult to by heart. So what we have to do means we have to divide this definition into different parts and we have to understand the meaning of that parts. Then we have to study each part. Then we have to club together all this combine together and we make the particular definition. So first let us divide the definition according to different aspects and concepts. We can divide this definition into 6 different parts or different components or aspects. So this definition can be divided into the first part, second part, third part, fourth part, fifth and sixth part. So how we can divide this definition into the 6 parts? So let us see that this definition includes what is nursing education, aims of nursing education, why nursing education is necessary, to whom we are going to care, and where is the settings for caring that particular client after the nursing program and nursing education such as GNM and BSc programs, and how it should be, how we should care to the particular client or to the patient. So like that there are 6 aspects or 6 components in the nursing definition. First is what is nursing education, second is aims of nursing education, then why, what is the reason why it is necessary, and to whom we give the care, where we give the care, and how the care should be given. So with this concept, if you understand that, it will be easy to study or easy to by heart the particular definition. So first is what is nursing education. Nursing education is a professional education. You know that nursing program is a professional course. BSc nursing is a professional course. So nursing education is a professional course which is consciously, systematically planned. So it is planned by very conscious, by going through in-depth discussion and systematically evidence-based. It is planned and implemented through the instruction and discipline. Instruction means using various methods of teaching and different ABAs tools, different classroom sessions, clinical sessions, outdoor visit, then education tour, etc. Okay, so implemented through instruction and discipline. So we follow strict rules and regulations to complete the particular program. So there are certain set rules to understand or to learn the nursing education. So nursing education is a professional education which is consciously and systematically planned and implemented through the various instructions like lecture method and other methods of education, methods of teaching, and following strict rules and regulation disciplines. So the first part of the definition is what is nursing education. Nursing education is a professional education which is consciously and systematically planned and implemented through the instruction and discipline. So that is the first part of the nursing definition. Second part is aim of nursing education. What is the aim? Aim of nursing education is harmonious development of the student. So the complete overall development of the student, modification of the personality and modification of the behavior. That is harmonious development of the students, which includes physical development, intellectual development, social development, emotional maturity, emotional development, spiritual development, and aesthetic development, aesthetic powers or aesthetic abilities. So all comprehensive development, that is known as harmonious development of the nursing students. So aim of nursing education is, or aims of nursing educations are harmonious development of the student that includes physical, intellectual, updating the knowledge, intellectual, social, emotional, spiritual, aesthetic powers or aesthetic abilities. So aim of nursing education is harmonious development of the student or the harmonious development of the nursing student. Next part is why it is. Why is nursing education? Why it is? in order to render the professional nursing care to the patient or to the family or to the community. So in order to render the professional nursing care. Professional nursing care could be done only by a professional registered nurse. Why is nursing education means in order to render the professional nursing care to the patients, clients, families, community, etc. That is the third part of the definition. Then fourth part is to whom? To people of all ages. We render nursing care to people of all ages in all phases of health, different stages of health, and all phases of illness, different stages of illness. So all people means people of all ages means from newborn to old age, which includes antenatal, intranatal, postnatal mothers, and reproductive age group, all the age group starting from newborn to old age, including antenatal, intranatal, postnatal, then reproductive age group. Then the phases of health, that is primary health, secondary and tertiary phases of health. So all level, primary, secondary and tertiary level, in the different phases of illness like mild, moderate, severe, fatal stages of illness. So all these stages we render the services. To whom? The people of all age groups and all phases of health and illness. All phases of health and illness of the people of all ages. They are the beneficiary of the health services. Then where we give the services or nursing care? In a variety of settings. As you know that we give nursing care in the hospital, in the health centers, in the clinics, camp, at home, school, factory, etc. So in a variety of settings. So render the services to the client, people of all age groups in a variety of settings such as hospital, health centers, clinics, camp, home, school, factory, etc. How? In a best possible way. Best possible way means a quality assured, comprehensive, maximum effective care to the client. So all these points has to be combined together. Then we have to understand the definition and we have to by heart the definition of nursing education. Let us see that how it is. So first part is, what is nursing education? Nursing education is a professional education which is consciously and systematically planned and implemented through instruction and discipline. And it aim of the nursing education, and it aims the harmonious development of the physical, intellectual, social, emotional, spiritual and aesthetic power or abilities of the students, nursing students. So that is the second part, that is aims. Then the third part is why. In order to render the professional nursing care. In order to render the professional nursing care. Then to whom? To people of all ages in all phases of health and illness. To people of all ages in all phases of health and illness. Where? In a variety of settings. So in a variety of settings, in a best or highest possible manner. In a best or highest possible manner, that is evidence based, quality assured, maximum comprehensive care to the client. So nursing education is a professional education which is consciously and systematically planned and implemented through instruction and discipline, and aims the harmonious development of the physical, intellectual, social, emotional, spiritual and aesthetic powers or abilities of the students in order to render the professional nursing care to people of all ages in all phases of health and illness in a variety of settings in the best or highest possible manner. So in short, nursing education is the professional education for the preparation of registered nurses to render the professional nursing care to people of all the ages in all phases of health and illness in a variety of settings. So that's all about the today's topic. So thanks for watching. Hope this video really benefits in your studies and education. Today we have discussed a simple topic, that is definition of nursing education. So if you feel it is really worth and beneficial, please like, share and subscribe my channel. Stay tuned with the Angel Health Academy for the next and important educational video. Thank you.